Thank you all for joining us here. My name is Izumi Nakano, and today's program is the Lymphoma Research Foundation's Talking with Your Healthcare Team series. During the presentation, I'll focus my discussion on seeking a second opinion and offering resources for ongoing support for those touched by a diagnosis of lymphoma or CLL. Before we begin the program, I'd like to share some information about the Lymphoma Research Foundation. Our mission is to realize the promise of science to eradicate lymphoma and serve the community touched by this disease. We're the nation's largest nonprofit organization that focuses specifically on lymphoma and CLL. All our work is led by our Scientific Advisory Board, which is a group of 45 leading lymphoma experts from around the country. The Lymphoma Research Foundation hosts more than 50 patient education programs each year to provide members of the lymphoma community with up-to-date information about lymphoma and treatment options. We offer both in-person and online programming. The first is our virtual Ask a Doctor national series of 2-hour topic-specific community-based programs that combine a presentation by a medical doctor with an extensive question and answer session. It's a great opportunity to have access to local lymphoma experts while tuning in over the phone or online. Another is the Lymphoma Workshop, which is a regional one-day educational program that provides the latest information about lymphoma diagnosis, current treatment options, and patient support issues. These programs are either in-person or virtual. Finally, there's also the Educational Forum on Lymphoma, which is an annual 2-day program providing presentations from expert speakers, disease and treatment-specific information on clinical trials, the latest advances in lymphoma research, and networking opportunity for members of the lymphoma community. Please save the date for our 2024 Educational Forum on Lymphoma, October 26th to the 27th. We do also have a free webinar, which are our hour-long interactive program led by leading lymphoma experts who discuss lymphoma, treatment options, clinical trials, and promising innovative research. Webinars can be listened to live on the telephone or via web streaming, and recordings of the program can also be accessed following the live program. In addition, Lymphoma Research Foundation also has free comprehensive disease guides and fact sheets, which can be ordered or downloaded on our website, lymphoma.org. Finally, we have an award-winning mobile app called Focus on Lymphoma. The app provides helpful disease content as well as unique tools to help you better manage your lymphoma. The app is available free of charge in the Apple App Store and in Google Play. In addition to today's program, we have a variety of other programs and services available for you. One example is the Foundation's Helpline, which serves to complement our patient education programs. The Helpline has master's level trained staff who provide individualized information on all types of lymphomas, as well as information on treatment options, clinical trial navigation, and connections to resources such as financial assistance. We also offer a peer support program called the Lymphoma Support Network. Through the Lymphoma Support Network, we can connect patients and caregivers with others who have been through a similar experience for emotional support. If you have any questions, please feel free to post your questions in the comments below. We'd like to thank our sponsors for the opportunity: AbbVie, AstraZeneca, Genentech Biogen, Kyowa Kirin, Ipsen, Genmab, and Merck. For today's programming, we'll be covering seeking a second opinion. Our agenda will be the following: learning about your diagnosis, when to seek a second opinion, questions to ask before seeking a second opinion, resources for finding a lymphoma specialist, managing a lymphoma diagnosis, support for your own mental health, and resources to find support. So it's important to know that lymphoma is not just one disease. There are 2 major types of lymphoma: Hodgkin's lymphoma and non-Hodgkin's lymphoma. Within those 2 categories, there are over 80 different subtypes. The specific subtype of lymphoma does impact treatment that is suggested, along with other factors such as age, stage of lymphoma, and other considerations. As I mentioned, there are a variety of issues that you and your physician will discuss in order to see what would work best for your particular type of lymphoma. Typically, the doctor will discuss the risks and benefits and side effects associated with a possible treatment choice applicable to that person. So, patients and caregivers should share questions and concerns with their doctor so that together they can decide which option is best. It's always helpful for patients to write down their questions and go over them with their treating physician and or healthcare team. What to expect. After an initial diagnosis of lymphoma, the doctor may order other tests such as blood work, imaging studies, heart and lung function tests, a bone marrow biopsy, and other procedures. This process is often called the workup or staging studies. Some of these tests are needed to determine a person's disease stage, a measure of whether and how much of the disease has spread to other parts of the body. Other tests check how the disease has affected a person's overall health and major organ functions. Together, these test results provide information needed to help patients and their doctors decide on our best course of treatment. Getting a second opinion, and I'll go into that in a little bit. But for clinical trials, a clinical trial is carefully designed research study that involves patients who volunteer to participate. The purpose of cancer clinical trials is to answer specific questions about new ways to prevent, diagnose, treat, and manage a disease or the side effects caused by a new or existing treatment. The investigators responsible for planning, conducting, and reporting results in a study in a clinical trial want to determine the safety and effectiveness of the treatment being investigated by making specific assessments before, during, and after the trial. These are all strict rules and procedures to make sure the clinical trials are designed and run in a way that protects the rights and safety of the people who volunteer to participate. The foundation offers a clinical trials information service that provides patients with information about investigating treatments for lymphoma being evaluated at cancer centers nationwide. Upon request, the foundation's helpline staff can conduct a search for potential lymphoma clinical trials based on medical information that has been provided by that person. So contact our lymphoma helpline at 800-500-9976 or email us at helpline@lymphoma.org, and we're more than happy to do that search for you and answer any questions that you may have. When to seek a second opinion. There can be misconceptions when it comes to seeking a second opinion. It's not meant to question the doctor's expertise, but to make sure that the suggested treatment plan is the best choice for that person, as well as to evaluate alternative treatment options, including clinical trials. This also does not mean that you're switching physicians. It's just truly a way to seek an opinion from another doctor. Questions to ask before seeking that second opinion. The following are things to consider and inquire about before taking the steps of getting that other opinion. First is to ask your doctor, can I hold off on beginning treatment so that I can seek a second opinion? Your doctor may want to begin treatment right away because of how aggressive the lymphoma may be. There are those individuals that can best decide what timeline you have for seeking a second opinion. It's also important to find out, will my insurance cover a second opinion? The answer may help you to decide where to seek that second opinion and if it is a good option for you. What resources are available to help me find referrals? There are different sites and ways to find these referrals. I'll go into that in a minute, but you should also find out what paperwork, test results, scans, and et cetera that you would need before seeking that second opinion. Different hospitals and institutions may have different procedures and information that they require. So it's important to be prepared with the items another physician or hospital requires before you're seen. And where can I find that support? Resources for finding a lymphoma specialist. One thing you can do is to ask a current doctor, family members, other patients, friends, and coworkers. Contact the patient referral service at your local hospital and at the nearest hospital associated with a medical school. Many hospitals have online directories that you can search to find a specialist in your area. Visit the foundation's website, lymphoma.org or contact the Foundation's helpline by phone 800-500-9976, or you can email us at helpline@lymphoma.org. However, note that we do not provide a physician referral service, but we can help you find those resources. Visit the American Society of Clinical Oncology website. You can search for oncologists through their database. You can also visit the American Society of Hematology website. They can also help you through their database find hematologists with an expertise in lymphoma. Finally, you can also visit the American Board of Medical Specialties to find out if your doctor is board certified in a particular specialty. Managing lymphoma diagnosis. Coping with a range of emotions such as feeling overwhelmed, denial, anger, fear, and worry, sadness, depression are all normal emotions that we feel. Each person's experience with cancer is different, and the way an individual copes with the physical and emotional impacts of lymphoma is unique to each patient's personality and situation. So it's important to practice self-care. That means eating a well-balanced diet, getting enough sleep, rest, especially when going through treatment, and exercise at your own abilities. It's also important to lean on your family and friends for support. Seeking the support of family, friends, and others you trust. The support of your family, friends, and others can be a great deal of help, both emotionally to lean on, but also to give you the assistance for your day-to-day chores, such as picking up groceries or helping with the housework. Learn about your disease and treatment options. Find the medical care that meets your needs. Feeling comfortable with your healthcare team to ask questions and discuss concerns can help to provide some sense of support and confidence in your care. Seek out additional resources of emotional or social support from people with cancer, such as the Foundation's Lymphoma Support Network, that connects patients and caregivers with volunteers who have experience with lymphoma, similar treatments, or challenges. Research the cost of care, what your insurance will cover, what financial assistance programs may be available to you. The Lymphoma Research Foundation does offer a limited amount of financial assistance. So please contact our helpline if you're interested. Maintain a copy of your medical records, paperwork, test results, and your own notes. Download and start using the Foundation's Focus on Lymphoma app on your mobile device to learn more about how to manage all of your medical records and paperwork and all your appointments. Support your own mental health. While each experience is different, a lymphoma diagnosis often comes with mixed emotions. You may have a hard time trying to return to your routine as it was before you were diagnosed with lymphoma. For instance, some things that you once did easily may now be challenging, or you may not have the same energy. It's also very common for patients to feel anxious about the future and to find particularly hard not knowing what will happen next. While feelings of sadness and worry are normal and may even decrease over time, this can have a negative impact on your daily life. This can manifest in different ways, such as trouble sleeping, changes in your appetite, lack of interest in activities that you previously enjoyed. So it's important to identify what you can control. Also, self-care will help you stay physically and emotionally healthy. So it's important that you practice self-care regularly to reset your physical and emotional well-being. Adopting routines of self-care will help you recharge your batteries and stay healthy. Talk with your healthcare team about developing a wellness plan to help you stay physically and emotionally healthy and improve your mood. Consider the following suggestions. Stay active with short periods of daily exercise, maybe 30 minutes of power walking or jogging or biking. If that's not possible, taking the stairs instead of the elevator, or maybe parking just a little bit further away than what you would normally do. Maintain a balanced diet by eating fruits and vegetables. Cut down on risk factors such as quitting smoking or reducing alcohol intake. Try to get 7 hours of sleep per night and take naps when needed. Meditation and deep breathing and stretching can also help you relax. Keeping a journal of your thoughts and feelings may help to let go of the worries and fears. Even if you don't share those with anyone, it's just an important way to journal and just release everything that you're feeling, and you're putting it down on paper. Communicate your fears and concerns about your disease by talking with your family and friends, doctors, and counselors. Even if you don't share it, it's always important to, again, journal and have somewhere that you can let all of those emotions and feelings out. Resources to find support. Again, I just wanted to highlight the importance of having support and where to find it. Personal support, leaning on your family and friends. Individual counseling. There are therapists and counselors that specialize in coping with a cancer diagnosis. Support groups through your cancer center or hospitals or other advocacy groups. Peer support. The foundation offers, as I mentioned, a one-to-one peer support program called the Lymphoma Support Network, where you can connect with a volunteer to hear about their experiences regarding a particular subtype of lymphoma or treatment that they may have been through. Online message boards can help. Social media may provide support and help you need while seeking that second opinion and your overall journey. So this concludes our program. Thank you for joining us. We'd like to again thank our sponsors, AbbVie, AstraZeneca, Genentech Biogen, Kyowa Kirin, Ipsen, Genmab, and Merck for making this program possible. Please remember that if you have any questions, you can post them in the comments below, or you can reach out to Lymphoma Research Foundation's helpline at 800-500-9976, or you can email us at helpline@lymphoma.org. And with that, I'd like to thank you all again for joining us, and have a wonderful day.